A new executive order from President Trump calls for children's vaccines to be spaced out so that they will get fewer shots at a time. That includes separating the measles, mumps, and rubella vaccine, the MMR vaccine, into 3 separate shots. We're joined by Dr. Celine Gounder, CBS News medical correspondent and editor-at-large for public health at KFF Health News. Dr. Gounder, good to see you. So this executive order upends decades of federal guidance. It recommends, as we just said, breaking up these vaccines into separate medical visits. Is there any scientific evidence to suggest that grouping vaccines together is dangerous or that it causes autism?
There is no evidence that spreading the shots out is safer or that giving them together causes autism. And regarding a potential link between vaccines and autism, this has been studied in more than 5 million kids in more than 40 studies across 7 countries with no increased risk. I think one of the other things is that there's been more awareness, better diagnosis of autism. So that's part of what we're seeing. There are a number of other factors that have not been investigated thoroughly, for example, as this potential link between vaccines and autism, which has not been found. We have not delved enough into other factors like genetics.
All right. So the president has suggested that combining the MMR vaccine could be, quote, quite lethal. He's not pulling that out of thin air, or perhaps he is, but where does that notion come from? And is splitting the vaccines even possible?
So he is pulling that out of thin air, to be very clear. And it is not possible to split them up right now because we do not have separate measles, mumps, and rubella vaccines. And so to bring that to market, you would have to go through your randomized clinical trials. You'd have to submit to the FDA. And then manufacturers would have to gear up to manufacture this specifically for a U.S. market because no one else in the world is going to use it.
All right. So these are government recommendations, federal government recommendations, but it's the states that establish school vaccine requirements. How should parents be responding to this? They should be talking to their pediatrician, but should they be worried at all?
Well, so first of all, this is going to be very difficult to enforce. The mandates for school vaccination are at the state and local level, not the federal government. So it's really unclear what this even means. That said, for now, follow what your pediatrician says. Where federal guidance does become important is really with respect to what your insurance company is required to cover. But for now, this doesn't change anything.
All right, that's good. Dr. Gounder, always great to have you. Thank you very much. Appreciate it.